Hello, my name is John Slattery of the Arkansas Children's Research Institute. The title of our paper is The Significance of the Enteric Microbiome on the Development of Childhood Disease, a review of prebiotic and probiotic therapies in disorders of childhood. In this article, myself and colleagues Dr. Derek McFabe of the Kylie Patchell Evans Autism Research Group, University of Western Ontario, London, Canada, and Dr. Richard Fry, also of the Arkansas Children's Research Institute, discuss, as the title implies, the significance of the enteric or gut microbiome and its relationship to childhood disease. The microbiome, and in particular the microbiota, refer to the trillions of microorganisms that inhabit our digestive tract. Research is beginning to show that the development of the microbiome is extremely important during the early part of life, and that disruption of the development of the microbiome may give rise to a wide variety of disorders that affect infants and children during critical points during development, with the first 3 years of life being critical for the development of the microbiome, and the first month of life as possibly being hypercritical for its development. In this article, we discuss the current evidence associated with enteric microbiota disruption and the relationship of this disturbance and risk for the following disorders: prematurity, necrotizing enterocolitis, sepsis, eczema, childhood malnutrition, allergies, asthma, inflammatory bowel disease, type 1 and type 2 diabetes and obesity, as well as autism spectrum disorder. Review each of these individually, discuss the microbiota disturbances associated with each condition, and also review and summarize treatments aimed at either preventing or treating each condition, and what the evidence to date is associated with treatment strategies aimed at manipulating or modulating the microbiome, with a special focus on prebiotics, probiotics, and, where it's been studied, symbiotics, which are a combination of probiotics and prebiotics. While the evidence is strong that microbiota disruption may be associated with several disorders, the data is either sparse, incomplete, or mixed on others. While we believe that treatment and/or prevention strategies aimed at manipulating the microbiome may play a pivotal role in the future of pediatric medicine, as well as in OB/GYN care of pregnant women, there is still much that is up for debate and a lack of consensus in the field, with critical questions that need to be addressed and/or answered. While we are encouraged that manipulation of the microbiome may be a worthwhile and important factor related to childhood disease prevention, as well as treatment strategies for certain disorders of childhood, we caution that much more research needs to be done to fully understand which treatments work best, for which subpopulations they may be best utilized, and the timing, dosing, frequency, and long-term effects of any such treatment aimed at manipulating the microbiome and/or its metabolic end products. It's also of extreme importance and of the utmost consideration to make sure that these are done right. Furthermore, while the technology may exist to examine the microbiome, there's still much uncertainty on the therapeutics that we have at our disposal, and much more research and development is needed in order to figure out which ones are the most effective, sensitive, and specific for each disease condition associated with disruption. We thank you for your attention to this important review of an exciting area of science and medicine, and we hope you find the review helpful, informative, and of interest.